We're live? Okay. I want to call to order the Eureka Springs Hospital Commission regular meeting on January the 17th, 2022. The commissioners attending are myself, Barbara Dix, Chair.
Kent Turner, Treasurer.
David Carlisle, Member.
Angie Shaw, CEO.
April Griffith, Secretary.
Judy Giggy.
Okay. We are all here. If you've had a chance to read the minutes for our regular meeting on December the 20th, 2021, are there any changes? Okay. So I need a motion to approve the minutes as written.
So moved.
Second.
Okay, minutes are approved. The approval of the agenda as written. Any additions or changes? And I think number 10, approval of med staff minutes, we need to remove that and approve it in the February meeting because we've just received them. So,
Make a motion we approve the agenda minus the 10th item.
okay. All right.
Second.
Okay, I don't see any public out there, do y'all?
I don't see anybody out there.
Nope, is anybody out there?
We don't even have press tonight.
No.
Not impressed, but
Okay, then we're ready for the treasurer's report. Kent?
Okay. You can just follow along on your sheet. No change in the checking account balance because we haven't paid any bills from this account. The money market received $430.78 in interest during the month of December. That left us a 12/31 balance of $1,449,606.41. The CD balance, it wasn't time for the interest to accrue to the CD balance, so it's the same as last month. At 12/31/2021, it was $437,999.76.
Okay, are there any questions for Kent? No? Okay, we're ready for committee reports. Kent, you're the only committee we have.
Okay. I'm going to report on future events as opposed to past events. As we've gone through the end of the fiscal year, there are several things that that need some attention. It is my intent to meet by phone or Zoom with Angie and Bill Stout sometime within the next 10 to 15 days to talk about audit, to talk about some changes that we need to make and how we're accounting for cash items, primarily of the board. And then once that's done, I will have an agenda item next month where we can talk about how we go forward with audit and how we go forward with going into the future with certain cash balances that we have. It is nothing nefarious. It's just more kind of putting things in a condition that they need to be put in, that they haven't been right in a while. Since we have only been in existence for a little over 2 years now, the reason audit has become so important, if we go out for bid for audit, we will have to, in fact, do 2 years probably, because I don't think 2020 was never audited, and then we'd have to look at 2021. And that's the kind of details that I want to go over with Bill and use the expertise of Bill and Angie to kind of formulate some consensus from their side, being they're the ones that have to live with it day to day before we come back and take any formal action.
Very good. Okay, any questions on that? Then Angie, let's do the CEO report.
All right. Well, as most of you know, we're going through a current COVID surge, which has increased our outpatient COVID testing Currently, our hospital and the health department are doing outpatient COVID testing. The other clinics in town are no longer doing outpatient COVID testing, so that has increased our outpatient flow. We're seeing, in the beginning, we were seeing anywhere from 60 to 80 tests a day, and right now it has cut back a little bit because we had to implement appointments to just to make it easier on staff and patients who are waiting to get tested. Also, due to the current surge, we have implemented back to wearing our N95s for staff. We've also limited visitor access to the facility and, of course, increased cleaning of touch point areas. Nursing administration is currently reviewing our quality assurance program as well as others to implement for the 2022 year. We're kind of seeing that in all the departments right now as going into January. Respiratory therapy is currently reviewing oxygen contracts, and our compliance officer is continuing to review state rules, regulations for critical access to make sure there's no changes that we need to be aware of for the 2022 year. And on top of that, they have also been setting up staff in-service manuals for annual in-house training. In the ER, we closed the year out with a total of 3,200 patients seen. That was an increase of 17% from the prior year. Hospital admissions from the ER equaled 319 for the year. In radiology, the first week of January, we had set up a meet and greet at the family clinic, and just to educate them regarding our radiology services. Unfortunately, that was canceled due to weather that day, and we are currently looking at dates to reschedule that time. We're planning on letting them know regarding our radiology testing that we can do, as well as let them know we have speech therapy in-house and any other questions they may have. Currently, our business office director is working with representatives with the electronic record system for the clinics. They're setting up forms and billing programs. We have also hired a business office manager for that clinic, and she is working with our director at the hospital to help set these programs as well. And she has been a great asset with outpatient COVID testing as well. She has stepped up and is taking phone calls and directing patients to appointment times. Our human resources is currently finalizing year-end payroll documentation, working on getting W-2s out to employees on time. Our marketing department, of course, Samantha just started the first week of January, but she is currently working on and improving the hospital's social media presence. She's been reaching out to community leaders and businesses regarding the hospital and services available, as well as creating partnerships for future community outreach. I know they have been working on a lot of great ideas to get us out in the community. She's also been completing press releases and sending them out to print publications. And she has also began reaching out to emergency room patients after discharge to complete surveys. And she has been receiving positive reviews from all the patients that she's been able to contact. As you know, the ER had been under remodel. That was completed the end of December. I've heard good things from both staff and patients in the community. It has really made a difference in our morale, I believe. The maintenance department and staff that worked together to complete the project, I couldn't be any prouder of them. They did a great job and teamwork. Now that that is completed, I believe in February, we're planning on starting the floor in the patient rooms and the hallways. And we'll be doing that 1 or 2 rooms at a time. And that's all I have. Any questions for me?
Angie, are we staying ahead of the game on COVID tests?
We are. I mean, we still have plenty in supply. It's been a little difficult to get them at times, but right now we're okay. And we continue to order every week, and so far we haven't been put on a back order status.
I think our director at one time had to drive to Little Rock to pick up
She did.
supplies.
Yeah.
She did.
So they're all working together and doing a great job.
And I will say, as far as I'm a person that runs in and out of the emergency room probably more than the normal person does, it really does look nice. The floor looks, it's a very clean feeling in there. The floor looks good. So they've done a good job with that.
Good.
Yeah. Okay, Bill Couch, you're up. CFO report.
I'm here.
I know.
Okay. Can y'all hear me okay?
Perfect.
Good audio.
Great. Let's start on page 2 of my report. Let me get it up here in front of me. What did I do with it? There it is. Yeah, okay. Pardon me. On page 2, you'll note our cash in bank position at the end of November was 1.5 million, and we're at 1.499 million. So very little change. And that is cash in bank at the end of the month. So it's not our true cash position because we will have outstanding checks written against those balances. But it is a consistent picture. On page 3, let's look at our revenue for the month of December. We'll note that it is $1,258,000. It is down from last month, 14%, but last month, the month of November, was the largest revenue month of the year. Our average revenue that we produced this last year is $1.21 million per month, and that's up 41% from last year. And so, very good news in that regard. On page 3, let's look at, this is our income statement. As it stands right now, I believe, actually I'm pretty sure that the deductions from revenue were overstated in relation to our gross revenue. And the reason for that is that I know that our cost report position, which we'll see on the balance sheet here in a moment, is not fairly stated. It will be. It's not yet properly stated, but it will be before we get 12/31/21 finalized. We've got to get our cost report prepared, and that will give us the correct position in order to make an adjustment to that, and that will be reflected in the months coming forward. On page 5 and 6 of our balance sheet, you'll note that our patient accounts receivable, 1.846 million, that is net of our allowance for contractual allowances. And then you can see our cost report position, negative $1,134,000. We do not owe Medicare or Medicaid any money. In fact, they owe us money. They sent us some money in December, I believe it was, November or December, to get us caught up on our interim rates, and they still are holding the cost report money from 12/31/20. I remind everyone of that. That will come to us because of the change of ownership. That will come to us when they settle that cost report. As we scan down the balance sheet, you'll note that our accounts payable position, $215,000, and then our only other liability is that for our accrued payroll and vacation or PTO for our employees. So those are the only liabilities. And once we get this cost report position, then we'll be in a better reporting light on a go-forward basis. And I'll be working on that cost report here in the near future and get that position taken care of. Are there any questions?
I don't have any.
Bill, I have just a logistical question for you. Is it killing you guys to get this stuff done by our meeting date? As a former accountant, I know how that can be.
Yeah. The 17th is almost as, I guess the earliest it could be the 1st, 8th, 15th. So the 17th is fairly early. I didn't get the reports until Friday. And then I need to, Angie, if you would send me all the commission members' email addresses. So when I send that out, I'll send it in a blast to everyone rather than piecemealing it out. And then that way we'll all get it at once and try to get that to you all as soon as we can. But yes, Ken, it is difficult to try to get a finalized balance sheet and income statement by the third Monday. But we can, as long as, that's okay with y'all and it's not as final as it could be, then I'm good with that. But Roger's doing a very good job getting everything adjusted. So we did some cleanup, and really the only thing I think that's out there that really needs to be adjusted would be the fixed assets, and then probably, and of course, the cost report position. So
Okay,
those are the two main areas.
Yeah, I just want to let you know, from my perspective, I'm not speaking for the other commissioners here. I know that's a killer. So and from my perspective, I would never have a problem with seeing a preliminary statements, as long as they're followed up at some point in time with the actual statements. Make sure that we don't miss them.
Yes.
So, we do a preliminary January, and then sometime, if it's even in February, we get a final, and it doesn't have, from my perspective, it doesn't have to be at the time of a meeting. Just so we ultimately get a final.
Yes.
Okay.
That would,
I don't know whether any of the
yeah,
other.
I'm used to working with my other hospitals. They go on the fourth Monday and fourth Tuesday, so there's an extra week in there. And I've just finished up their months, and as we get Scott trained up, I think we'll be in a much better position on a go-forward basis there. And he'll be there from day to day to day. Roger's working remotely, of course, as am I, but Scott would be the glue to the situation. And so we just need to get him prepared to make the journal entries that have to be made month in, month out.
Okay, I just wanted to throw that out there because I know 17 days is not an inordinate amount of time to get financial statements out, okay? Most corporations don't do it until the 25th, and sometimes it's the 5th of the month following, so.
So would you want him just to mail us a preliminary
Yeah,
and then,
Yeah, if we have to have a preliminary for the meeting, then a final to follow up would be great, and then we don't have to talk about it again, but we have in our files what the actual financial statements were for each month.
I'm good with that if everybody else is.
I'm okay with that. I understand it can be really tight when you're trying to prepare reports and you have this, which fluctuates depending on the date and how long the month is too. Yeah.
So would we review those the final?
In my opinion, unless there's something significant, what we do is we would base our discussions on the preliminary, and then we just receive the final.
Okay, so we'd assume the final would pretty much be
It's
minor corrections.
It'd be some corrections. If there's a major correction, then
We would be notified.
Yeah.
Okay, any questions for Bill? Thank you, Bill, for everything you do.
You bet. My pleasure.
Okay, the next item is election of vice chair for a one-year term. Since I am filling Dr. Burden's term of 1 year, and our executive board has a 2-year term, I thought that we would just fill this for 1 year, and then next December, we start again with a new board elections. So can I have a nomination or a volunteer? And I did talk to the mayor, and he said one of our two, secretary or treasurer, could be the vice chair also, if at this time you guys, no one else wanted to do it. So can I have a motion?
Can I ask a question first?
Yes.
What are the additional responsibilities of the vice chair? Is it to run the meetings when the chair cannot be present?
Yes, when we get a big snowstorm, you have to run the meeting. Yeah, or, yeah, that's basically, you would stand in with Angie if I were sick, or just kind of take over the chair's duties. But that would be all. Don't everybody jump up at once. Kent, can I nominate you?
You can't nominate anybody.
Oh.
I don't mind doing it because I don't think it's, based upon what we've past history, it's not been a big deal.
I'd like to nominate Kent Turner to be vice chair.
Consider being into those things.
Yeah,
Since I can't, April nominated you. And really, I did not. Okay. All right. So all in favor, say aye.
Aye.
Okay. And April, if you could put it in proper English in these minutes to reflect that it's a one-year term, because your term and Kent's term is up January next year. And then I will take that to the bank and get new checking status fixed. Okay, we postponed med staff minutes because we didn't receive them yet. Now it's approval of medical bylaws for the hospital, and I had them send you out a email so that you can kind of just read it on your computer rather than printing out 60 pages and trying to get them delivered. So we do have a hard copy that will always be in our office, and that's why they came by email rather than by mail. So could I have a motion to approve the medical bylaws? It's the medical.
Motion to approve the amendment for bylaws.
Okay. David?
Second.
Okay. All in favor?
Aye.
Aye.
Okay, the meeting dates for 2022. The regular meetings are at the odd at 6 p.m. on the third Monday of the month. And those dates are January the 17th, February the 21st, March the 21st, April the 18th, May the 16th, June the 20th, July the 18th, August 19th, September 17th, November the 21st, and December the 19th. Then our workshops are at Main Stage, 12 noon on the first Saturday of the month. And that will be February the 5th, March the 5th, April the 2nd, May the 7th, June the 4th, July the 2nd, August the 6th, September the 3rd, October the 5th, and December the 3rd. So, with that's the end of our agenda, do we have any commissioners' comments? Judy?
I have a question.
Okay.
You referred to that being in our office. I have no idea where the office is.
Well, Yeah, it's at the hospital. And one of these days, you can call Angie or myself, and I'll show you where it's at. And we're actually sharing it now with a speech therapist. But our filing cabinets are in there, and that's where this will be.
Okay. So basically, that's the only time we'd have to go is if we had to go into the files.
Do what?
Basically, that's the only time we'd ever have to go there is if we had a question had to go into the files.
Or if you just wanted to research the commission, and we finally got things together going all the way far back, I think 1911 or 10 or 9.
I probably don't need anything from 19.
No, it really doesn't. Okay, April, do you have anything?
No comment.
David?
No comment.
No comment.
Well, y'all are really chatty, aren't you? Okay, I really don't have anything except to express my gratitude for our employees. They have stepped up to the plate with COVID and helping get everything and doing double duty and 2 shifts, and it's crazy how it's been out there, but they're doing a great job. And I would ask that the community be kind and sweet to them, because I know everybody's scared and they're sick or they don't feel good, but they are really ripping them a new one when it comes to being swabbed or being treated. And if you could just be kinder and more gentle. Is that all right?
Sounds like a great request.
Sounds
Sounds
like,
like a great request.
Okay, so with that, I'll ask to adjourn. Okay.
Motion.
David moved to adjourn.
Second the motion.
Okay, guys.
thanks, Bill.